Hello, everyone watching and listening. And this is a special edition of Eye on the Community. Filling in for Sean Anthony today, I am Stowe, and joining me are the wonderful people at Ohio State Wexner Medical Center. I have Jakeithia and Reggie. How are you all doing today?
Doing good.
Doing great. Glad to be here.
Glad that you all are here. And we got some big news to tell the community, and it is all about Healthy Community Day. So can you all tell me, if you can, and this is for both of you, what Healthy Community Day is?
Sure, I'll start. So Healthy Community Day is this Saturday from 9 to 1 at our Outpatient East location, which is 543 Taylor Avenue. And Healthy Community Day is a way for us to do health screenings, to get out more information about different social determinants of health. We have over 80 different booths and vendors that are coming, food, fun, games, everything.
Yeah, and I would just like to add to it. This would be actually my first year participating, but from my understanding, this has been over 20 years in the community, and something that East Hospital is really proud of and really to be a part of with the community. I've attended the event numerous times, and it is a really great event, and a lot of people really appreciate that. And it's been a little bit different during COVID times, but we think we're a little bit back to normal this year, and so really looking forward to hopefully good weather, good participation, and just having a lot of fun.
So why does OSU do this event every year? Like, what is the inspiration behind holding this annual event?
I'll start. Maybe Jakeithia can jump in there. And so, really, this is an opportunity to provide some screenings and some care for people who may normally never be able to see a provider, and to have that. And so we're able to do all of the various screenings that we're able to do. Also do some sports physicals, which is great for, our student athletes as well. And really, hopefully get them a connection to a provider if need be. And so really showing them that we're out in the community. We really want to help. We recognize that this isn't, something that's offered all the time, and it's free. And people are able to do that. And we're able to give them some of their data and let them know how important it is to take care of themselves, to care for their health, and be connected to a provider if possible. I don't know if Jakeith, anything you want to add to that? Or
I think that the thing that this does is makes it very non-threatening for a lot of people who might be nervous about coming into a doctor's appointment or things like that. This is, community. It's more of an engagement. It's more of a conversation. No one has white lab coats on. We have T-shirts and jeans on. Like, it's very, low key. So if anyone is nervous about ever having screenings or nervous about what it might be, this is the greatest opportunity for them to get their health checked out. If you've ever thought about I might have high blood pressure, come get it checked out. You might and you might not. This is the greatest opportunity to get that done, and it doesn't cost you anything. We'll have PT there. You can learn if you have a gait issue, that you might have I have this pain in the back, but I really don't want to go check it with my doctor. Come there. We have screenings for you.
No, that's huge. And it makes, because a lot of times going to medical professionals can be, like you were saying, intimidating, because we don't want to go anywhere on purpose to get bad news and then have to pay to get the bad news.
Right.
So at least the cost is cut out. And hopefully it's not bad news, but if it is, you're aware of it and can take those next steps.
Well, and the great thing about these screenings are, if you say that you have high blood pressure or you do need PT, those people that are doing the screenings are the ones that do it at our Outpatient East and also at our East Hospital. So those are the people that you would see. So you might meet Becky, who works in the lab. You'll see her there at Community Day, and you'll also see her in the lab, which I think is a great thing, because it's that connection that you have. That's that OSU community coming together.
Yeah, and building relationships is huge, because a big factor in seeking medical attention is that issue or element of trust. Like, is this person going to tell me what I need to know? And so to put a face with a position and a facility is huge in doing that. Reggie, did you have anything to add to that?
No, I'm just really agreeing, and Jaquita makes such a good point, just making that connection and makes it less intimidating, just as you were saying. And I think that's why this event has been so successful in the past, and people, really look forward to it and coming. And obviously there's a DJ and there's food, and so make it kind of fun to come get some screenings done and doing that. And again, as Jaquita said, a lot of people, don't get cared for until they come to this day, and then they look forward to that.
Right.
Well, and one of the other things, I'm sorry, that I wanted
to add that
we're doing is we're going to have OHSU have HR. So you can do an on-the-spot interview, which really doesn't happen at healthcare events. So not only can you get a screening done, but you might be able to get a job too.
And that's huge. So what, so we can just go and keep talking about that. What positions could people possibly get?
So the way that they're going to do it this time is actually they're going to have recruiters for every single position, and they'll get to meet with somebody and get to interview and kind of get to know what they're looking for, and then see what matches.
Okay, that's good. So we mentioned earlier a little bit about the pandemic and COVID-19, and that literally impacted the world and every person in every industry, and ironically, even the medical industry, and specifically this event that OSU does. So how did you all work through that, and how are you bouncing back this year?
You want to take that? You want to start, Jaquita?
I can start. So last year we scaled down and we did drive-thrus. So it was more about giving out information, giving out produce, giving out food and things like that. This year we're doing like what we did before COVID. So the screenings and everything else.
Okay.
Yes, I would say, obviously a lot more in person, more personal. People are able to, ask questions, make that connection. I think in the past we really wanted to give out the flu shot. We want to do other things to make sure that they still have their vaccines, but now we're able to get back to the screenings and to do that. Obviously, we still want to be careful and cautious, since COVID's still around, but I think, we all feel comfortable that we're able to do more things in person.
And so, and Reggie, you said that this was your first time on this side of this event, but you have been an attendee. So how have you seen this event evolve for over the years that you have attended?
Yeah, I think, every year it's gotten bigger and bigger, and it's just been amazing to watch all of the Ohio State volunteers, which is also employees, come, and everyone is really excited about it. I mean, we do not struggle at all to get volunteers to really help with this event, which is amazing. So people really want to give back to the community. They really want to help, and they know it's going to be busy, it's going to be fun, but they really feel like they're helping people and doing that anywhere from our frontline staff, all the way up to our nurses, our medical assistants, all the way up to our providers. And Dr. Jaquita has done an amazing job of organizing this whole day and doing that. And so we're so really grateful for her time and her work in doing it. But we know that everybody's really committed, and they just know how big this is. And people look forward to this day, and they look forward to volunteering and really helping the community.
Yeah. And so, Jaquita, how have you seen the event evolve over time?
This year we're going to do a lot more community. We're going to have community partners. We're really addressing the social determinants of health. We're going to have like rent assistant programs, the Franklin County benefit program, their new van is going to be there, code is going to be there. So really trying to get more engaging. We also this year had community partners put out yard signs in their yard and around the community to be a part of this.
No, that's big. And I think it's something that can't be overlooked, the location of where you all are having it. And as much as it's trying to be built up to look different, we know that the community that lives there is still the same. So can you all speak on to who you're serving in that neighborhood that you are located?
You take it, Jakeithia.
No, I'll let you go because I know I've been talking more than you
No,
have.
you're leading this. I'll let you kind of.
Okay. So the reason why we picked, so they picked this a long time ago, actually 20 years ago, they picked this location because of that demographic and because of the zip code and because of the population. And we wanted to make sure that that population was served the most because it was the ones that were not coming to the doctor. It was the ones that were the hardest ones. Actually, right now, it's still the ones that don't have COVID vaccines. It's the ones that don't have care. So that was why they wanted to focus on that area. And we still feel it's that important still to this day.
And we have heard from the community how much they appreciate the event, and that we keep it going, that we're there. And again, a lot of people really go to this event to really get some of their initial screenings, and they really utilize that to get their information and say, okay, yeah, I do need to go see a cardiologist. My blood pressure was high, or I had my diabetic screening, and I need to connect with the endocrinologist to start to get this in line. So we hear from the community how much they look forward to this as well, and they always have the date penciled in their calendar, and they really show up.
Yeah. So Reggie, I'm curious to know, because you all do so much for the community, and we'll talk about that in a second. But how can the community help OSU in response? Because if we're still doing these events because of the lack of awareness or the lack of participation, how can we better be mindful to be a part?
Yeah, I think the key would be, using this event and other events as a springboard to connect to a primary care doctor. Being able to, and we have right there, Outpatient Care East, as Jakeithia mentioned, we have a nice crew of doctors who are willing to see new patients, who are able to do that, but going in and taking care. So if you have loved ones who haven't seen a doctor in 10 years, connect them with their primary care, so then that way they can have these screenings done, and then, they can do some preventative care, and they can stay on top of their care. And I know that, oftentimes in the community, people don't want to go to the last minute. I think maybe you even mentioned that as well. We don't want to go get that news, but it's ensuring that your loved ones or even yourself is connected to a primary care physician. And so that way, we can get the colonoscopy, we can get all of the proper screenings that we need to prevent before it's too late to do that. And so I think at the community, if you know someone who hasn't been to a provider in several years, figure out, how we can do that and how we can help connect them to someone to take care of themselves. That's good.
Keithia, you have anything to add to that?
No, he said it perfectly.
Yeah. No, I think that's huge, because, it's good to have these conversations. It's good to have these events, and it's great that we have, organizations in the community that take the time out of what you all do to put this on. But I think the community itself, the people that live in the community, the people that you're trying to reach and to serve, hold up our end of the bargain and participate and be a part, and just hold ourselves accountable and give ourselves a chance to make life better.
Right.
Absolutely. And bring somebody with you.
Yeah.
Don't just keep it to yourself.
Right. And that's huge too, because we will have the tendency to, as if, cause we get it for free, and then we want to hold on to it, like let everybody know, so we can all be well. We can all, because it's more to come after us, and so we want to be prepared to let the next generation know, or let the next neighbor know, or the next friend know that may not know.
Yeah, and again, I'll say, really using this event as a springboard to say, okay, I have high blood pressure, and we say, okay, we're going to connect you with this provider, and being able to get them connected, make an appointment, and hopefully they show up and they do that, and then that's part of it. So then, they don't have to wait every year for this event before they have these screenings done, but then they can also tell their family member, their friend, that, yeah, I went to this event, I realized I had some issues, they connected me with someone, and now I'm dealing with it, and I'm getting some treatment for that, and now I'm back onto having a healthier lifestyle and doing some of those things. So we hope that all those connections and that word of mouth will help the community and people to do that, and to follow up and understand the importance before it's too late. We've seen so many people when it's stage 4 or whatever it be, and it's too late to do that. So we want to be on that front end of that and connecting people before that happens.
No,
and we'll have community health workers there to help with any barriers that might happen. That you can't get a ride or you don't have this or that. We have community health workers right there on the right there at the event that can help you make your appointment, help you with anything else. And the great thing about this event is you can make an appointment right then and there too. So they say that you have high blood pressure, go make an appointment. They will walk you to where the registration to make an appointment. And then you say, well, I don't have a ride or I don't have gas money. They'll walk you to the community health workers to help you figure out how to do that. So there really is no reason why you can't do the follow-up.
Yeah, and Jaquita is right. Those community health workers play such an important role to eliminate those barriers and doing that. And I think that's so important because we know that they're still like, okay, I made that appointment, but I can't get there, or I can't pay this. But if we're able to help that way to even make it as smooth as we can to get you there and to do all that, we will certainly do that to make it easier for everyone.
That's good. That's good. Talking to Jaquita and Reggie about Healthy Community Day at OHSU East, happening Saturday, June the 4th. And a question I have, especially talking about setting that appointment and meeting with the doctor, like how do you know who's the right doctor for you or the right health organization or facility for you?
Yeah, I think, sometimes you don't know until you come in and you figure out, who's the right fit for you, but you want to find that person that's going to listen to you, that understands you, that understands, what you need, and they're making you a part of the care and, helping to understand that. Oftentimes you may get someone, you say, yeah, I just didn't like that vibe. And, we can connect you with someone else that you will be able to do that with. But truly, you want to connect with that physician who's able to listen to you and understand, what you want, and then they can explain to you what we can provide and what we can do for you, and make sure it's a good fit on both sides.
I totally agree. I also tell people to have questions.
Yes.
Interview this person. You want to hire them for your job. So interview them, ask questions about the way that you are. I'm this type of person. How does that work for you? How will we engage in this? How will you answer these kind of questions? And if that works for you, then, that's great. If not, there's always somebody else. Because OHSU has plenty of people. So if this office doesn't work for you, maybe another office works for you. Maybe the one in New Albany works for you. There's plenty.
Yeah, and you want to establish that trust, and so then that way you understand what they're saying. You want to follow their plan of care. You know that sometimes people think, oh, they're ordering things for me because they want to get the money or the insurance or whatever. But that's not necessarily the case. We don't want to do that. We only want to do what you absolutely need. And as part of that is establishing that trust and making sure that you and the provider are on the same page.
But I would also caution people about job hopping or physician hopping. And that's where, oh, well, this person told me this. I don't want to hear this. So I'm going to go to this person. They're probably going to still tell you the same thing. But if you keep going from provider to provider or, OSU to Ohio Health or things like that, you're not going to get consistent care.
Yeah. No, that's huge. Are there any, not, obviously not saying the names or anything, but are there any cases where you have seen these type of events that you're doing with the Healthy Community Day, like turn someone's health habits around? So like maybe someone that wasn't going to the doctor before and now is. Do you have any of those stories that you are aware of?
Yeah, so a couple of people have, because of going to this, they have had, they've established, a primary care doc. One of the things that we have primary care docs at the booth that are going to be looking for new patients. So you could really interview somebody and get to and establish that person. And then we had people who got physicals or, figured out that they had high blood pressure and was able to really get that taken care of. People don't think that high blood pressure is that big of a deal, but it can lead to so many different things.
And I've talked to several patients that, the reason that they were at Outpatient Care East as a patient is because of the community day. And they said, hey, I was back here in June and now I'm here for my follow-up appointment in August. And it's really because of that day and made that a connection. And so, and they're going right to the building that they were seen in the parking lot at. And so that also, is, great for them that they're familiar and they're going in. And, but I've heard that from, at least dozens of patients that it's because of that day that they're in the building now and they're part of the OHSU family.
That's big. And so part of your community initiative is also to educate. So how does the education factor into a healthy community day?
Go ahead.
Go ahead, Jaquita. I want to take your thunder. I can tell you had a thought there. Go ahead.
So, I am a community health worker, so I try to do education with anything. When we looked at these booths and we looked at all of our vendors, we made sure that, so not only are you going to do screenings, but like PT has an education about cluttered houses and how to do fall risk. So every single booth has some kind of education component. I think that you have to learn and be able to ask questions about almost anything. So we have like breast health, how to do your screening. So you will get in our tent, you'll get that education. We have a vendor that's going to do CPR that will teach, how to do CPR. You won't get a card, you won't get certified, but it might be something that you might need to know right then and there, kind of thing. We'll have different types of those kind of educations.
Well, and I think when you're at the event as well and you get some of your numbers back, what really does that mean? And that person there or has information there to explain that to you and let you know you could be at risk, or, how quickly you should be seen or why it's important for you to be seen because your hemoglobin A1C is 8 and that's extremely high and that can lead to some further issues. And so, we want to get you in right away and the importance of it. And so I think as you're getting the information, you're also, getting some education behind it as well.
Yeah, I think that's huge. And just from, me participating in health days or free, events like this, sometimes you find out that you're not doing enough of something. I remember one time for me, I found out that my cholesterol was too low. I'm like, well, isn't that what it's supposed to be? So can you kind of speak on that, Rich? I saw something come to mind when I said that.
Yeah. So, I think you're right. Although you may be feeling great and you're exercising, you're doing the right things, you're like, I'm well on my way, but there may be some genetic history or there may be, some things, again, in your family, or there may be some things that you shouldn't be doing that much of that's impacting that. And so you get to learn more about that as you receive your numbers. You think like, well, I feel great. And it just may not have caught up with you yet. And some of those things you're doing, and it could be excessive or it could be under. And that's why it's so important to know your numbers and to track and trend your numbers over years. So you say, okay, I know I'm getting better, or I'm maintaining there. And what are some tactics you can do to make improvements and to get you where you need to be. And although you may be feeling like you're at optimal health, your numbers may speak differently, and you're just kind of waiting on something else to occur or to happen. So I think that's why it's so important is to establish with that primary care and have that yearly appointment and get the proper screenings, whether you're 40, you're 50, you're 60, and you stay on top of that. I just think it's so important.
Wow. Yeah, and I think like you talked about knowing your medical history. Like, honestly, I probably don't know my medical history past my parents. And not knowing, what could have skipped over a generation or still is in existence, and like my parents may not have just addressed it. I think that is huge to know your history so you understand what's could happen in the future.
Yeah, but even knowing your parents is definitely a good start, and a lot of folks don't even know that and say, well, I think my dad had high blood pressure or whatever, and then
Right.
know how that's going to impact you. But I think even just knowing that helps the provider know what we can expect and what we can anticipate, and the reasons why, and again, that's why they do take a great family history, and knowing some of that, and that may be the difference of getting a colonoscopy when you're 40 as opposed to when you're 50, because of your family history and why it's so important.
Wow. So you all do the Community Health Day, Healthy Community Day, but there are other initiatives that you have that serve the community as well. Could you speak on those?
You want to talk a little bit, Jaquita, about the fall event that we have as well, that I know that's more vaccine related, but.
So it's basically like a healthy community day also, but it's in the fall, and it's to get flu vaccines and to get COVID vaccines. You'll be able to get your COVID booster vaccine at Community Day if you are in need of it. But yeah, so our fall one is it's more of a autumn and kind of more vaccine related. But we also have other kind of initiatives like this, where we have like town hall meetings where we are working with our Healthy Community Center and things like that.
Yeah, and that's what I was hoping. Jaquita was saying she's being very, very modest, but I know that she's part of a prostate walk that she helped kind of lead last year, and
Wow.
we have the heart walk. I mean, we have a lot of other community events that may be focused on a particular specialty, if you will. But Jaquita is really involved in the community and really helps lead a lot of those things, and just bring a more awareness. And we have physicians there as well. I know that, in the past we've done, and I think we even have this there where we kind of focus on the colon and the importance of colonoscopies and doing that there. And some of our main physicians, lead that. But Jaquita has really helped. And again, COVID has kind of slowed things down as far as how much we can do in person and doing that. But Jaquita has really done a great job of bringing a lot of those events back and really leading some of those events and doing that.
Thank you.
That's huge. I mean, like I said, do what you are trained professionally to do, in addition to, willing to stop and have an intentional focus on the community, I think is very commendable and something that you all should be very proud of.
Thank you. Yeah, and again, as a medical center, we definitely want to continue, and that's part of our, strategic plan. That's part of our mission, is to be involved in the community, to help the community, to listen, like Jaquita said, to town hall meetings and say, okay, we want to change focus and provide this for our community, and to do that. And we have so many people that are willing to volunteer and help the community, and I think that's great. And so, we really try to do what the community needs, not what we think the community needs, but what we hear from the community, and provide that for them.
And we really want to be a part of the community. So that's why this project has been so successful. I mean, this event does not cost anyone anything. We give out free food, we give out free screenings, we give out produce, we give out so many things. And, it costs a lot, but we don't give that cost to anybody because we have that commitment to the community. And any of our other events that we do, we don't charge anyone anything.
No, that's huge. That's huge. And that's, there's a integrity in doing that,
Exactly.
and I think that is what, needs to be highlighted, because I mean, you don't have to, what I mean? Like you don't have to, but the fact that you want to, and you want to mold it around the real wants and the real needs of the community, and not, someone outside of the community stereotyping the community to figure out what that community needs. I think is huge.
Yeah, and I think that's why we're here. We're here for the community, and want to be a part of the community. And if it wasn't for the community, we wouldn't have the things that we have. And so, it's important to give back. And again, that's why so many people volunteer for this day on Saturday, and look forward to this day, and people really want to be a part of it.
Yeah. So just one more time, can you let us know when, where, and how we can be involved in Healthy Community Day with you all?
So it's June the 4th from 9 to 1, and it is at our Outpatient East location, which is 543 Taylor Avenue. And it is on our website also, and it is on our Facebook. And I'm sure if you look around anywhere close to OHSU East and CarePoint, you'll see some yard signs.
Yeah, and right off when you get off the 670 there at Leonard Avenue, you make a right. There's a big semi that has a big poster, talks about Community Day, and it's going to be right there in that parking lot, just right across the street. So it's been there for a couple of weeks. They're reminding people to say, hey, it's back and it's coming back, and we're really, really looking forward to it.
And both Reggie and I will be there at Community Day. So if you see us, talk to us. Tell us if you heard us on this.
That's awesome. Keithia and Reggie, thank you so much for joining me today on Eye on the Community. I know it's going to be a huge turnout for this, and I just, pray that lives continue to be changed and health history of families can be improved because of events like this that you all do.
Thank you for allowing us to do this.
Yes, thank you so much. Thanks for your time.
All righty. Thank you all.
Bye-bye.